Hello, this is Mia from Talking Diabetes. Today I'd like to talk to you about hypoglycemia. Hypoglycemia is just another way of saying low blood glucose levels. For people with diabetes who are taking medications to manage their diabetes, we want their blood glucoses to be between at least above 4. If it's less than 4, we consider this to be hypoglycemia. This is the benchmark that we have set for Melbourne, Australia. I do understand that in other parts of the world, their benchmarks might be slightly different, but this is the one that I'm talking about today. A blood glucose of less than 4 denotes hypoglycemia. Hypoglycemia is undesirable, and if it's occurring, we need to take actions to treat it. The first thing you need to do is, if you're experiencing symptoms of hypoglycemia, these could be hot and sweaty, trembling, pins and needles in the face, around the eyes, the shakes, feeling very hangry, so getting irritable. You might not even realize that this is happening. So perhaps your loved one notices a change in your behavior. If this happens to you, please check your blood glucose. Ideally, you should have a blood glucose meter with you at all times, especially if you're taking insulin. So do yourself a favor and carry with you, wherever you go, a blood glucose meter. If you have your blood glucose meter with you, please check your blood glucose levels. If you don't have it, learn by your mistake and prepare yourself next time. The first thing to do is to take some rapid acting glucose. 15 grams of carbohydrates, of something that's really absorbed very quickly, basically sugar. So this could be in the form of 5 jelly beans, a smallish glass of lemonade, orange juice, apple juice, something like that. You can go to the chemist, you can buy things like Lucozade or glucose tablets, anything like that. About 15 grams of carbohydrates. Or if you don't have any of those things around you, you can have 3 teaspoons of sugar in water and just drink it. The key point is to get some sugar into you and get it into you really quickly. Wait 10 to 15 minutes. You should start to feel better as that's working. Wait 10 to 15 minutes and then recheck your blood glucose levels. If the blood glucose is above 4, you move on to the second part of the treatment. If it's not yet above 4, you need to go back and repeat the first part of the treatment. Let's say that it is now above 4. What you need to do is go to the second part of the treatment, which is to have some carbohydrates. You either must have a snack containing carbohydrates, or you can sit down and eat your meal, but make sure it does have carbohydrates in it. Be warned, if you're having hypos, that's not normal. That's undesirable. That should cause you to go and see your doctor, talk to your diabetes educator, make some inquiries, because it's a sign that something's wrong. Maybe your medication needs to be reviewed. Maybe your insulin doses aren't right. Maybe you've changed your diet, you've lost weight, you've been more active than what you used to be. Anything like this could cause a hypo, and if it happens, it's a sign that something's not right. So please go and get your hypos investigated. Don't put up with hypos. We don't want you to be having hypos. Thanks for watching. And if there's anything you'd like to talk about on Talking Diabetes, please let me know and we'll make a video on it. Thank you.